Welcome to The Beauty Shift, proudly sponsored by Keranique, America's #1 hair regrowth system created by women for women.
I'm Michelle Phillips.
I'm a celebrity stylist and beauty expert, a national TV personality, and self-confidence coach. And over the years, I've worked with some of the most recognized faces in the world, helping them look and feel their absolute best inside and out.
That ultimate inner outer wow. Now that's true beauty, my friends.
Welcome back to The Beauty Shift. I'm your host, Michelle Phillips. I'm so glad you're here today because this is going to be a very powerful conversation. It's all about science, skin, and the powerful connection between how we look and feel. I'm so thrilled to welcome my guest today. She is redefining the modern approach to beauty, confidence, and wellness. Her name is Dr. Sabrina Fabi. She's a renowned cosmetic dermatologist, international speaker, and co-founder of the groundbreaking skincare brand XOMD. Dr. Fabi is known for her compassionate, innovative approach to aesthetic medicine, from cutting-edge non-invasive procedures to skincare that taps into the science of mood and well-being. Dr. Fabi is at the forefront of a movement that goes far beyond appearance. She is helping patients look and feel their most authentic, radiant versions of themselves. So if you're ready for some fresh insight, some real inspiration, and some tangible tips to glow from the inside out, let's get to it. Please join me in welcoming Dr. Fabi to the show. Dr. Fabi, welcome to the show. I'm super excited to have you here.
Thank you so much for having me, Michelle. I appreciate it.
Yeah, I mean, I've got a million questions for you because I get a ton of questions from my clients, from women in my private membership group. They're always coming to me, skincare. What's the latest with, different treatments, all of that, which I would love to ask you all those questions as we go along. But first and foremost, I really just wanted to come out of the gate talking about beauty today,
Yeah.
as opposed to even 10 years ago. I mean,
Mm.
so much has happened in the world of skincare, technology. I remember when I was a makeup artist working for CBS and in television and movies, and we didn't even have Botox back then. We didn't have airbrushing and all that stuff. So,
You got a lot to
today,
cover up.
I know it was like, so much has happened in the past, probably 15 years
Yeah.
that's really transformed the industry. Um, and so it's a good thing, but in the same, token, there's also a lot of women that I see that are going in the direction of really wanting to improve how they look, but they overdo it.
Yeah.
So, I would love to just kind of talk about that in the beginning of the show today, because I feel as if, there's so many wonderful things that we can do, but we also want to
Mhm.
make sure that we're really careful about that. And I know that you're all about really that holistic, mindset, and not just trying to help fix people in terms of how they look.
Yes, so it's a passion of mine because we take an oath as physicians to do no harm. And so that was something that I had to reconcile with myself, practicing in something that's elective, like aesthetic medicine. And so how is it that we're participating? I think that every person who's practicing in this space has to ask themselves, honestly, how am I participating in perhaps a dysmorphia or making people look peculiar? You never want to be that person that's participating in that, because we've all seen those faces as we check out from the grocery store, that basically are all over these magazine covers, and you're wondering, how did it get to that? And so I had those honest questions for myself because I never wanted to be the cause of that. And so that's something that I actually published on called Perception Drift. And this is that people do come in, they authentically want to look natural from the things that you're doing. They don't want to look like a different person. But all of a sudden, that same person 6 months later or 1 year later is the same person asking you for more. And so it started making me wonder, is it that all of these people have body dysmorphia? Or is it, because that would be a lot of people, or is it that there's something else that's happening when we embark on these procedures that perhaps distorts the way that we perceive ourselves? And so this is a phenomenon. If we look at body dysmorphia, there is this local and global processing. So our ability to switch from perseverating on that one line over our upper lip to seeing that one line in the whole of that face. And so when we do something, we perseverate on the small thing. We're focusing on that one nasolabial fold or that tear trough. But the goal for the brain is to switch back to seeing it in the context of the whole face. But it quickly accommodates back to baseline. And so now it's used to having no tear trough, no nasolabial fold. And so it goes on to focus or fixate on something else, like maybe a jowl. And so from that place, you can start entering a slippery slope unless you also have someone, a trusted provider that can kind of, serve as like a guardrail. Look at your before and after photos with every intervention and say, hey, we're drifting away from what you began, because it's easy to do, especially if you don't have somebody who's trustworthy that's injecting you, or someone who doesn't take before and after photos to compare back to. And so it is a real phenomenon, Michelle.
Absolutely. My girlfriend is a laser specialist here in Tampa. And I started getting laser, I want to say probably 16 or 17 years ago because I had severe acne when I was in
Yep.
my 30s. I mean, cystic acne. So I used to get Fraxel laser and it completely changed my skin and got rid of the acne and the pock marks and all that. And so through time, when I just meet with her and stuff, she's always like, I have so much power, it's scary that women come into my office and they want this, that, and the other. And if I was one of those irresponsible doctors, I would do whatever they wanted. And she
Yep.
said, but I don't.
Right.
Because if I do, then, that's first of all not who she is. But there are a lot of clients that I personally have that will call me up and say, Michelle, what do I do? I'm under my desk at work. I just went to my dermatologist or to a med spa and
Yep.
I had something done and now I feel I'm a tomato, my face is red or I'm swollen. And I say, what did you do?
Right.
9 times out of 10, they don't know. They have no clue what they just did. And so that's why I was so excited to talk to you because I know you are one of those, you're the top dermatologist in San Diego, but you're also very well known throughout the country with such a great reputation because you don't believe in this type of practice to where women just come in and say, this is what I want. And you go, oh, okay. That's not how you operate.
Right.
Um, do you feel that there needs to be more education so that women are, I mean, I feel like there's this missing link that women are walking into a med spa, for example, and there's not a physician right there. It's maybe a nurse practitioner or someone or an esthetician, and they're having things done that they don't know what they are.
So there's three things. I think that you're totally on something there, right? Like one is like reframing how we look at these procedures. They're ultimately medical procedures. Many, all, if not all, require some level of either FDA clearance of their neuromodulators, approval, or a clearance of their fillers. So, they go and undergo through rigorous testing, many of which we do here in our practice. And I've participated as an investigator. So they should be treated as such. So just because someone has chosen to put them on Groupon or to try to devalue that this is a medical procedure shouldn't be how the consumer perceives it. It's still, if someone wants to discount and offer it on Groupon, that's like, if they want to minimize what this is, that's their choice. But as a consumer, kind of being smarter about that this is my body, I wouldn't, select my chemo on Groupon, right? I wouldn't like select my blood pressure medication, based on the discount of the day. Like, that's how I would, first go into aesthetic medicine as what it is, medicine. Two, that goes with who you choose as your provider, right? So just like you would find like the most qualified, experienced, individual with excellent reviews, who people have gone to, and who has a wealth of information and education is how I would select, right? Like you would select your, breast cancer surgeon doctor.
Yeah, or dentist or
Uh,
right.
so,
Yeah.
so that's how I would choose. That would be the criteria. So it's like, how would I choose my breast cancer surgeon is how I would choose this individual, right? Because you have one face, and you want to treat it accordingly, right? With respect, through someone who is knowledgeable and skillful. Two, I'd pay attention to that individual's before and after photos. Do they have them? And if they do they align with your aesthetic? Because there is a marriage of art and medicine here. And so you do have to see what their aesthetic is, not just what their credentials are, too. So it's a marriage of those two things. And then making sure that they say no. So I think a good kind of, like signal for me is if someone is just always says yes. But if they say, no, you don't need that right now, or like that's generally a pretty good indicator of someone who's making the best decisions for you and not for their pocketbook.
Exactly. I'm learning that some fillers are okay. Some I've heard don't ever go away. Like they actually, is this true? That they
Um,
actually can stay in your face and maybe move around over years or time or I
uh,
mean, I like Sculptra because I know Sculptra is something that's more natural. But I've just heard that there's, a lot of controversy about some fillers.
I think that people are also just taking pieces and then and like little examples and then like an N of 1 or an N of 10, which is still a very small sample size, and then trying to make it like a headline, and so we have to be cautious with that. I think there's a place for all of them. I love Sculptra, participated in their phase 3 clinical trial, have personally been getting injected with it for over 12 years. It's an excellent biostimulator. But also with anything, it in the hands of anyone, things can be used incorrectly and cause a problem. Same is true with fillers. Hyaluronic acid fillers are excellent. Generally, there is a range. You're absolutely right, Michelle, in that some of them might only last like 6 months to 8 months, depending on the properties of that filler. And some of them may last, more, let's say 2 years, or at least that's how long the trial was done for. It's not a bad thing. Actually, it was in the place. There was no comment in that trial if it had been moved. There was no mention of that. That's kind of anecdotal for other, scenarios. But in this particular study, what they found was that in some places the filler lasts quite a bit of time. So you may not necessarily need to inject your cheek every single year just because the filler study only showed that it lasts a year. The clinical effect lasted a year. Having somebody that's knowledgeable enough to know that in some places filler lives, like the tear trough. I've seen filler live there for about 10 years. Now, if properly placed, it's wonderful because it doesn't make your tear trough look as, hollow as it once was, right? But perhaps a good reason to not keep getting it re-injected.
Right. Right. Again, hence why you go to someone with experience and, you're board certified you're a dermatologist, board certified. That to me is very important as well when you have someone injecting your face or doing lasers. Can you talk about why that is really important for people to take into consideration?
Well, being a board certified dermatologist means that you go through 4 years of undergraduate education. Now it's very popular to even do a gap year in between of research. Most of us, at least in my generation, then went on to do 4 years of medical school and then 4 years of residency. So in total, you've done a solid 12 years of education focused around medicine. And when we talk about dermatology specifically, it's 4 years devoted to really part of our core curriculum is the fillers, hyaluronic acid, how it integrates with the skin, because it is one of the natural constituents of our skin. We examine that skin under, pathology and under slides under the microscope to understand how things integrate, how things might react towards things that are injected into the skin. There's a respect around what breaks down over time, not just clinically, but also under the microscope in histopathology. And then we also have a respect for how lasers and lights interact with that skin, depending on maybe one's ethnicity, because it's not just how melanated your skin is or how pigmented it is, but perhaps the shape of your melanocyte, because this is all part of the discipline of skin pathology, right? And understanding the skin. So with that, when somebody does a laser procedure or an injectable or a chemical peel or even recommends a skincare product, there is an understanding just as a dermatologist, yes, but then also holistically being an MD or a DO, the interplay of that with the rest of the body. Because when one goes into menopause, things that are happening systemically are also affecting the skin, which is your largest organ. So you do have a more comprehensive understanding of all of this because it is part of the specialty and the curriculum that we have to study and pass to become board certified.
Right, which is extremely important. Again, you're dealing with your face, your body, your health as
Right.
well. The lasers, I would love to talk about that. So many women that come to me, they say, what do you do to look more youthful? Of course, I eat well, I exercise, I get good sleep, I take good care of my skin, drink lots of water. Those to me are the foundation. But I do get laser. The lasers to me, like I said, I started off with the Fraxel laser years ago because of acne. But then as time went on, I would, do the IPL I would actually keep doing the fractional laser for building collagen naturally. And then most recently, a couple years ago, I had Morpheus 8, which I saw incredible results with. I'm mid 50s, so it's like I'm I'm fighting it all. But talk about the lasers. I know you have something I'm extremely intrigued by, and that's the Take 10. Oh, got to know about this. But in general, before we get to that, what do lasers actually do? Because to me, I feel like it's a more natural way of rebuilding collagen and keeping more of a youthful appearance without, I don't do fillers. I've done Sculptra, but
Yes.
in the past, it's been probably about 5 years, but talk about why they're so beneficial.
So lasers, well, first, why do we even do lasers, right? Your
Right.
skin is your visual certificate of health. That's why people do so much makeup, right? Because they're trying to make it flawless, even in complexion, trying to hide lumps and bumps, trying to minimize the appearance of lines and wrinkles, trying to make it look as smooth and as radiant as possible, right? So that's what we're aiming for. Why are we aiming for that? Whether it's with makeup, skincare, or lasers, it's because that is our visual certificate of health. That's why there's an entire discipline dedicated to the skin, which is dermatology. And so from an evolutionary biology standpoint, when we see someone within 10 seconds, we've already had a first impression of that individual based on their appearance, whether it's superficial or not. That skin is telling us a lot of things, their state, their health status, right? As well as, and generally, if you look at evolutionary biology, it's to kind of give us an idea of mate value, how fertile someone might be, right? But today it also has an impact on how young or old we perceive someone to be, right? So that's ultimately the goal with any of these interventions, whether it is makeup or skincare or lasers. Now, lasers, I would think and agree that are probably the most effective when it comes to addressing ailments of the skin, whether it's shrinking your oil glands to improve the appearance of acne because you don't want to maybe do Accutane, or whether it's to close off blood vessels that no topical skincare is ever going to effectively do for the long term. So whether it's treating your rosacea, right, or those pesky blood vessels that form around the nose. So when you eliminate these things, your skin looks more even in its tone, and then you're perceived as looking healthier. But of course, there are side effects we've noticed from lasers, which is that the skin looks a little more youthful and it looks a little bit more radiant when you do things to address the brown or the red. And so with that, we started applying it also to resurface or to smoothen out wrinkles or to remodel acne scars, which is what you did, because we realized that the laser is delivering a certain amount of heat, some more effectively than others, that release something in our body called heat shock proteins. And those proteins actually promote the building blocks of new collagen to form, healthy, youthful collagen to form. And so there's no microneedling device that can create that heat shock protein. There's no topical skincare that can do it. It has to be heat from a laser, but it has to be a certain amount of heat that's going to create enough of those heat shock proteins to create a meaningful result. So now you have improvement in redness, pigment, lines, wrinkles, and your skin looks smoother in complexion. So you don't really need as much makeup, right? And sometimes not everybody wants to wear makeup during the day. You know, they'll reserve it for like a special occasion, but they want to feel confident in their skin from when they wake up to during the day when they have no makeup on.
Absolutely. And I actually feel like my skin looks better today than it did when I was in my 40s. I just want to take a quick moment to thank our amazing sponsor, Keranique, the go-to brand for women's hair growth solutions. If you're looking for healthier, thicker, more beautiful hair, no matter what hair concerns you have, Keranique has got you covered. Their products are clinically proven and dermatologist recommended, offering a complete hair care system, including treatments, shampoos, conditioners, and supplements to help you achieve stronger, fuller looking hair from the inside out. So whether you're starting your hair regrowth journey or maintaining gorgeous, healthy locks, Keranique has a solution for you. And as a Beauty Shift listener, you get 25% off site-wide. All you have to do is head over to store.keranique.com and use the code BeautyShift25 at checkout. Thanks again, Keranique, for supporting the Beauty Shift and helping women everywhere feel confident and beautiful. So now let's get back to the show. You have something called Take 10, which I find interesting because you said it's a combination of 3 different types of lasers. So I would love to know more about that.
So we call it Take 10 because there was one study that was really interesting that took faces, just photos, added a bunch of lines and wrinkles, and by doing so, you made the face look 10 years older. So we know that lines and wrinkles can contribute to perception of age more than red and brown. And so when you eliminate those lines and wrinkles, then the thought is that you can make the face look up to 10 years younger. And so we played off that study because it was really interesting. And so perhaps the reason subconsciously why people are trying to get rid of lines and wrinkles with neuromodulators, but not every line and wrinkle is amenable to a neuromodulator like Botox, Dysport, or the others. Some, perhaps some of the lines out here, especially the ones under the eye, and especially the ones over the upper lip, the barcode lines, it's like sometimes if you put too much neuromodulator or filler, it can look a bit peculiar. And so it really takes a combination of lasers. It's not just one. And so that's why we coined the Take 10, because it's not like, oh, we're just doing a Fraxel. We do a combination of fully ablative CO2 resurfacing to kind of pair out those lines, a combination of fully ablative erbium to trace some of the individual wrinkles that are still a bit stubborn. We do a potentially, if it's needed, a long pulse 1064 laser, and that's the laser that can target blue and really target that pesky blue vein under the eye that can contribute to a hollowness or a sunkenness or a darkness of the eye, but it's not volume loss, it's a vein.
Right.
And then
I have those. You can see through. Yeah, the blue.
You can see them, right? And then depending on what the person has, because we customize it, that's why it can be up to 5. We might do a Q-switched alexandrite laser for some of the individual carbuncles, or like an IPL pulse dye laser for the blood vessels.
Do you do it all in one treatment, or is it over a series? Wow. Yeah. Is there a lot of downtown?
Yeah, there's 7 to 10, as like with anything that's good, you have to pay, there's no free lunch, right? So it's about 7 to 10 days of bloody, crusty kind of redness. But after that, I find that my patients don't even need to revisit doing it for at least 4 years. So
Wow.
the effect lasts quite a bit of time.
Yeah. And what about the neck area? Is that effective on the neck? Because I've always found that things don't always work on the neck as they do in the face.
You're right, because you have 10% of the pilosebaceous units that we heal from on the neck like we have on the face. So you can't be as aggressive. If you
Mhm.
can't be that aggressive, you can't have as great of a result. So unfortunately, although we use a series of combinations of lasers there, it's not as effective. And sometimes we have to rely on some of the biostimulators, the injectables like Dilute Radiesse or Sculptra, to kind of help thicken up that skin as well.
Right. Okay. Love it. Interesting. Because that's
Yeah.
what I think a lot of people don't realize is that, I mean, there are alternatives to plastic surgery. And, the lasers, to me, in my opinion, from what I've seen, you can really improve the skin tremendously.
That's when you need somebody that you see to, like really kind of, guide you, shepherd you through the journey. Because I see people that think that plastic surgery, even if they have a tight jawline, is going to get rid of the lines over their upper lip or some of the lines here. But pulling things tighter doesn't mean that it's going to change the quality of the skin. So seeing someone that can kind of guide you through that decision and that is open to always refer you out, whether it's to a facial plastic surgeon or an oculoplastic surgeon, depending on what the issue is, I think is also a really good indicator that you're seeing the right person.
Right. Because your skin still hollow. There's not as much fullness there, even if you had plastic surgery. So that's what women also don't understand is that you can get it pulled tighter, but then you still don't have the volume there. So that's why people look like they're going through a wind tunnel. There's like as you said, there's an art form to this, and there's definitely it's not just a one and done. It's really about looking at your options, educating yourself, and speaking to the right people about what's bothering you, because I don't feel that there's anything wrong personally with having things done. Because if it makes you feel good about yourself, go for it. I'm also, as a beauty expert, I'm also a life coach because I found that no matter what I did to help women look great on the outside, it didn't matter if they didn't feel good on the inside. So there
Correct.
was always this conflict. But
Yes.
I feel that they also do feed each other. When you look better, you feel better. When you feel better, you look better. And I know
Yes.
this is your belief system as well, which is why I was so excited to have you on the show too, because there needs to be more of this mindset, in my opinion, because we all want to strive to improve how we feel and how we look. So there's nothing wrong with this, but we just want to make sure we get the right education and through the right people so we can make the right decisions on how to improve how you feel and how you look.
I agree. I mean, some of the people that we see out there that look great, but you can't tell that they have had anything done, those are the people that we emulate sometimes. And it's great work that has helped them kind of look like they've had nothing done, but that they've just aged perfectly or that they have great genetics. And there's no doubt or substitute for great genetics. I'm not saying that, but
Yeah.
it's probably really good work that's helped them there, and consistency with getting that good work done. I think the people that look the best, at least in my practice now in the last 15 years, are those that, just like those that go to the gym and have that six pack, it's the people that are constantly doing something. You don't have to do a lot, and it's generally, like you've pointed out, almost just addressing the skin, that keeps you looking great time after time. So I couldn't agree with you more.
And I love, speaking of skin, so you've developed a skincare line,
Yes.
which is very unique. I don't want to botch it up by trying to explain what it is. So I'm just going to let you share. But I love that you're really tapping into, I would say, body chemistry. Is that
Yes, I
right?
agree. So, kind of sharing your similar philosophy, I noticed that patients, no matter how mathematically perfect they have been, sometimes they didn't feel as perfect as they looked, so there's definitely more at play than just a perfectly mathematical, golden ratio face. Leaning into that, my partner and I, Dr. Stephen Dayan, who is a facial plastic surgeon, who has in a New York Times bestseller, who has really published a lot in the literature on attractiveness. Is it always the perfect face that is the most attractive? And what is it that really makes somebody most attractive? And if you really kind of look time and time again, it's probably confidence. That's what really makes somebody more noticeable when they walk into the room than just the perfect, beautiful face. And so how can you impart that, beyond a syringe? And so there was a great study that I had reviewed back in 2019 that showed that those that had higher oxytocin levels, even if they had been sunbathing more than those that had not, were looked on average 3 years younger than the other group. And so I started kind of thinking, and oxytocin is something, again, understanding skin biology, that is excreted locally at the level of the skin. So we have access to this. It's available to us, but we haven't been doing anything to hone in on it and to perhaps increase its effects. And so, of course, many of us love hugs and kisses, but perhaps we don't have that available to us every minute of the day. How could we potentially increase the effects of oxytocin at the level of the skin? And really reap on the effects it has. I noticed during the time that I formulated this product, I got pregnant. And when I was pregnant, I looked, to your point, more supple, dewy, despite the fact that I wasn't sleeping because I was being kicked around all night.
Yeah.
I looked really, really good, like more youthful. And so oxytocin, and you can tell when someone's in love, what is that? That really calls your attention and makes them more attractive to one, right? And when we look at the science of oxytocin at the level of the skin, we know that it tends to increase dermal water content. So it draws in water into the second layer of the skin, which is why somebody looks a little bit more dewy and radiant. It also is a natural antioxidant. So it reduces redness and inflammation, which is why in the trial that we ended up doing, we found that the most notable metric was a decrease in redness in as early as 4 weeks when people were on it, in addition to the dewiness and radiance we expected to see as a result of that oxytocin-like glow. And so in practice, it's always really hard to do something beyond a laser to help with redness, but redness definitely feeds pigmentary conditions like melasma, and it's such a frustrating component to treat. Most people that are red tend to have sensitive skin, which I have. I have eczema. So I wanted to almost create something for myself to keep the dew and radiance alive that I had while I was pregnant, and be able to not break out from it and minimize, the redness that you just get from age. And so that's how XOMD was conceived. It's
Fantastic.
it's
Wow.
stimulating the oxytocin release at the level of the skin.
So the products basically, they're targeting the redness and the different issues that we have as we're aging. So the
Yes.
oxytocin, does it actually have that in it, or it increases it through?
Great question. No, it is a botanical derived product. So we have jasmine, like it's a jasmine peptide that has been found to bind to the oxytocin receptor and then also increase the amount of oxytocin receptors one has. And so through that, in the trial, we saw very similar effects that I saw in that trial in 2019 when people had natural levels of high oxytocin where they look 3 years younger. And so other interesting things, because we were just kind of curious, what we added to it was a carob derivative. Carob is a derivative of like chocolate or cocoa. And it also has been found to have pheromone-like effects. And so if we coupled that with oxytocin, which generally has an effect that makes you more attractive, could we see or perceive people as having a better first impression, which we talked about, or being more attractive? And we did. Subjects that were on it compared to placebo significantly were deemed by 2,200 masked assessors, because we put out a survey monkey and people had no idea which one was the before and the after, but those that were on the XOMD significantly had better first impressions than those that were not, and were deemed more attractive as well. And in relationships, those that were in relationships, partners had no idea that they were on it, were deemed to be more sexually desirable than those that were on the placebo. So it was a really interesting study. And really, one of the few out there that is taking advantage of something that we naturally have in our body.
Oh, okay. Now I have to try.
You do? Yes. I'm just going to send you some.
Oh, okay. I'm a skincare junkie, but this is intriguing. I've never heard of anything like it. Fantastic.
Yeah, we
Really
don't want to
exciting.
create something everybody else has created. I think we
Yeah,
just kind of, really tapping into a philosophy of why we do what we do. Why do people do what they do? It's
right,
not to just get rid of a line or a wrinkle, right? It's
right,
to feel better about themselves. And
right.
there's probably no other molecule that makes you feel better than this one.
I love it. Absolutely love it. What is, I know you're a very busy lady, so I don't want to keep you here all day, but I feel like we have a part two coming down the line.
Yes.
We're probably going to get a lot more questions from this show because I do get so many from women. But overall, there's so many people out there, which drives me crazy because I'm professionally trained in aesthetics and makeup artistry, hair, the whole nine yards. People are giving out a lot of information online that is not professional advice. And I know a lot of women that purchase products from people that are not giving professional advice. And then their skin, they're using their faces as what I call science experiments.
Mhm.
They're combining a lot of different things on their skin, and but they're doing so because they're grasping at straws, trying to find something to help them look and feel better. What is your overall advice for women when it comes to skin health and really, trying to find what's right for them? I mean, we've given a lot of information today. I hope that they do go to you. But if they're just kind of like, I'm just overwhelmed and I don't even know where to begin.
I think, and honestly, this is where seeing a board certified dermatologist would help you, right? There's no one that knows the science of skin more. And then, depending on where you are in your stage of life, if you're perimenopausal or if you're menopausal, if you are dealing with adult onset acne, if you have PCOS, like there can be other things that can be systemically manifesting in your skin. So it's like, it's not just superficial, right? The skin
Right.
can sometimes demonstrate what's happening systemically. So going to someone who has that understanding, because maybe the skincare products all can't answer the need. Perhaps it needs to be prescription. Perhaps you have, a form of dandruff that's affecting the flakiness around your nose, and that's a prescription. That's not, your skincare that's causing it. Or perhaps it's because you're in that perimenopausal period and you're starting to see a decrease in that estrogen, or you just started the GLP ones, and those are having an effect on your fat layer, which can then have an effect on your skin. So it's not, this is again, this medicine. There's a practice to this. And so sometimes getting the guidance of somebody who's an expert can be a good first step, just to kind of, orient yourself around what it is that you're using and if it's even necessary. And is there any science to support its claim? Because some of these things aren't cheap. So you want to make sure if you're going to do the investment that at least it's worthy for your skin. It's appropriate for you.
Right.
It's not like you have to keep going to that individual of that doctor, but at least kind of starting there, just as groundwork to kind of guide you, because most derms will see you like once a year.
Yeah.
But I think that it's not a bad idea to start there. And then that person can also kind of guide you on what's possible. Maybe your redness is really rosacea and you may need a prescription, or you
Right.
may need a laser. And it's not just that you're reacting to a product. So there's a lot there. And so I would say if you're overwhelmed, don't take on the burden of diagnosing yourself. That's a big burden to take on. Rely on an expert who's done 12 years of training to help guide you and steward you through it.
I totally agree. And thank you so much for that because that's what I see is people diagnosing themselves.
That's a big
And then
hurdle.
they come to me and they're like, what happened? And I'm like, what did you do? Just
Right.
stop. Yeah. So great advice. Reach out to a board certified dermatologist. And if they're in your area or want to fly out to you, even better. How can people get in touch with you and learn more about your practice as well as your skincare brand?
They can follow us at XOMD Skin on Instagram, or go to xomdskin.com to learn more about the product. And then also my handle is sabrina.fabi, Fabi on Instagram.
Fantastic. Thank you so much for your
Thank
time
you.
today. Seriously, I would love to have you back. Maybe we'll get some questions from viewers that we can, and listeners that we can ask you on their behalf.
That would be
If you're
great.
open to that.
Yeah, I would love it. Thank you.
Oh,
Thank
you're welcome. Dr. Fabi, your insights today were truly inspiring, so informative and educational. I learned a lot, and I hope you guys did too. To learn more about Dr. Fabi's work and the XOMD skincare line, just head on over to xomdskin.com. And as always, if you love this episode, please share it with someone who you think would enjoy it. And please don't forget to subscribe to The Beauty Shift. Stay tuned for more conversations that help you look and feel your best at every stage of life. So until next time, take care of yourself, inside and out.
I want to take a moment to thank our sponsor, Keranique, America's #1 hair regrowth system created by women for women. I hope you enjoyed the show, and if you did, please feel free to share with your friends, and don't forget to subscribe so you don't miss an episode. And if you'd like to receive my free beauty and wellness gifts, just go to my website, michellephillips.com. I also invite you to join my social media community on Facebook and Instagram, Michelle Phillips Beauty.